Why do we give oxygen to a patient and what are required to give oxygen to a patient? When a patient is suffering from breathing problem and is admitted to a hospital or nursing home, then oxygen is given. What are the tools that is needed for giving oxygen? Oxygen cylinder, nasal cannula, oxygen mask, high mask, and for humidifying oxygen, humidifier. Generally, a patient is given oxygen with these equipments. According to the condition of breathing trouble, the process of giving oxygen are of different types. For mild breathlessness, we use nasal cannula. But if breathing trouble continues, then we have to use oxygen mask. If after using mask we find there is still lack of oxygen and breathing trouble is continuing, then we use bag mask or high mask for external therapy only. We generally give oxygen to a patient from cylinder. The oxygen that is present in these cylinders are dry. We do not give dry oxygen to patient because that makes their throat dry. So we use water from the humidifying chamber to humidify the oxygen. For that, firstly, we have to fill the humidifying chamber with water. We now open the chamber carefully. There are two levels in this chamber: minimum and maximum. When lower level of oxygen is to be given, then we fill the cylinder with maximum level with water, which we now pour into the chamber. Now we carefully set the chamber inside the cylinder. Then we take the nasal cannula. This has two openings. This is cylinder trip and this is nasal trip. Now we first attach the cylinder trip with the cylinder. After this, we will switch on the oxygen. You can see this black knob here. This will mention the meter, that is how much oxygen has been given. Now the anterior trip of the nasal cannula will be attached to the patient's nose. Then we will give oxygen to the patient by nasal cannula. We will now go to the patient, lower the mask and attach the nasal trip of the cannula with the patient's nose. It has two sides. By fixing it with the front of the patient's head over the ears with the help of measurement knob. After the nasal cannula is attached with the patient's nose, we will fix the nasal cannula with the fixture tape. And then we will now turn on the knob of the cylinder and with the help of flow meter, titrate the oxygen. Now you can see the flow meter. This flow meter will detect the flow of oxygen required. With this knob, by keeping a maximum 2 liter water, we give oxygen to the patient through nasal cannula. When we gave oxygen to the patient in nasal cannula, then the water level was maximum. But since that did not ease the patient's breathing trouble, we will now increase the level of oxygen. So, we reduce the water level slightly from the humidifier. We pour out some water and store it in this glass. Now, we again set the humidifier inside the cylinder. After this, we will give the patient oxygen through oxygen mask. This is oxygen mask. This is the mask and this is the cylinder trip. I will attach this cylinder trip with the oxygen cylinder. Now, we attach the mask strip with the patient's mouth. After removing the face mask of the patient, I will fix the mask strip with the patient's mouth with the help of 2 strings on both sides. We have attached the oxygen mask with the patient's mouth. We had earlier given 2 liter oxygen in cannula. But since the patient's breathing problem is not easy, we have taken oxygen in the mask and with the help of this regulator, we increase the level of oxygen. As you can see, the oxygen in the flow meter starts above 4. We can give oxygen up to 8 liter in the mask. We have given oxygen to the patient first through nasal cannula and then through oxygen mask. But we have seen that neither did it improve the respiration rate nor is the breathing trouble easing. In that case, we will be using the bag mask or high mask or reservoir mask, where in this balloon part oxygen will be reserved and the patient will intake oxygen as much as necessary from this mask. And this is the mask and this is the nozzle. It has two trips. One is being attached with the mask and the other we have attached with the cylinder trip. Since here we will give oxygen to a greater level, the water level has to be decreased to minimum. So we have now reduced the water of the humidifier in this glass. Now we attach this humidifier with the cylinder. Now we will attach the mask with the patient's face. Now we start the oxygen cylinder, adjust the oxygen level to high and inflate this bag. Then we will lower the face mask of the patient and inflate the bag mask or reservoir mask. After finishing the whole process, we have to disinfect the used equipments. We will now disinfect the nasal cannula. I take this cotton and soak it in alcohol swab. Then we clean the cylinder trip of the cannula first. Now slowly, this will reach the nasal trip. We will now slowly take the nasal trip and disinfect the cannula. Now we will disinfect the oxygen mask. Here we take cotton. Now we pour alcohol from the bottle on this cotton. Now I will disinfect the oxygen mask. Firstly, I will disinfect the nasal trip. After that, we keep it aside here. Then we will properly clean the inside of the face mask with cotton and alcohol, especially where the adapter is. It is disinfected and it has to be properly disinfected thoroughly. Then we attach the adapter. This side of the oxygen mask is attached to the cylinder. We will now give oxygen to the patient. We will disinfect the bag mask in the same way and then use it with the patient. First, I take cotton and then make it ready with alcohol. Then we first clean the bag mask. This is to be attached with the patient's mouth. Then in the back portion, the upper side has to be disinfected properly. Then we take the connector nozzle and disinfect it properly with alcohol swab. Now the bag mask is disinfected. The cylinder portion has to be attached with the cylinder and then oxygen supply is to be given to the patient. This is how we have learned how to give oxygen to a patient.